This module will talk about conservative kidney care. Conservative care means choosing not to do dialysis and not to have a kidney transplant. Conservative kidney care is another treatment option for people with kidney failure. In this module, we will talk about what conservative kidney care is, why someone would choose conservative kidney care, what things a person needs to consider when making a decision, and who will look after you if you choose conservative kidney care. Conservative kidney care is a treatment option for managing advanced chronic kidney disease. It does not include dialysis or kidney transplant. The goal of conservative kidney care is to preserve quality of life, control and treat any symptoms from chronic kidney disease, and keep the kidneys working for as long as possible. Conservative kidney care is a holistic, person and family-centered approach to care that includes cultural protocols and customs blended with Western medicine for the best quality of life. Sometimes, healthcare professionals do not know what these protocols and customs are, so you and your family will need to let them know. Conservative kidney care does not mean do nothing. You will continue to receive active, high-quality health care to treat your symptoms and keep your kidneys working for as long as possible. However, it is important to know that a person's kidney function will continue to decrease until the end of life. Conservative kidney care does not mean death is going to happen right away. How long a person lives when choosing conservative kidney care is different from person to person, as everyone's health situation is unique to them. People may live for days, weeks, months, or sometimes years without dialysis. This all depends on the amount of kidney function a person has, how many symptoms, and what other medical conditions they have. It has been shown that people over the age of 75 with decreasing kidney function and other medical conditions can live just as long with conservative kidney care as similar people who received dialysis treatments. Conservative kidney care is not suicide. People have the right to refuse medical treatment, including dialysis, especially if they feel it will not help them or improve their quality of life. There are many things involved in conservative kidney care: treating symptoms of advanced kidney disease, keeping remaining kidney function for as long as possible, supporting mental, spiritual, and emotional well-being, helping people plan for end of life. There are many reasons why someone would choose conservative kidney care. People who choose conservative kidney care know that they are not eligible for a kidney transplant. Dialysis may not help everyone live longer or improve their quality of life. Some people feel that their life has been fulfilled and do not necessarily want to prolong their life. For other people, the side effects of dialysis may even lower their quality of life or make them feel worse. Dialysis also does not treat other medical conditions like diabetes, heart problems, arthritis, or pain. Other people want to put priority on their loved ones' well-being and not be a burden. Some people feel that for them, the burden of dialysis is not worth the benefits of dialysis, and so choose conservative kidney care. We also know that some people will not do well on dialysis, which means they will not live longer or feel better. These are people who have other serious illnesses, such as heart disease, some types of cancer, or dementia. People who are already very frail, needing help with basic activities of daily living, like bathing, getting dressed, or walking, even with an aid, are very likely to do poorly on dialysis, with a very fast decline in all abilities, such that they need nursing home care very quickly. Conservative kidney care may be a better treatment option for some people. Sometimes people choose to start dialysis to see how it goes, but they may reach a stage where staying on dialysis is a struggle, and they no longer are getting the benefits of dialysis treatments. This is when they may choose conservative kidney care and stop dialysis. Conservative kidney care may be the best treatment for some people. Stopping dialysis is not suicide. Everyone has the right to stop treatments, including dialysis, if they feel that the dialysis treatments are no longer improving their quality of life. How long a person lives after stopping dialysis varies from person to person. People who stop dialysis may live anywhere from 1 day to several weeks. This all depends on how much kidney function you have left and what other medical conditions you have. What should you consider when making your decision about conservative kidney care? Some of the things to think about. What is your prognosis? This means how long you are predicted to live. If you do not know, ask your kidney doctor. How important is leading an active life or being independent? What are your other medical conditions? What are the side effects of dialysis treatments? Will you be able to handle them? What will your quality of life be like? People who are older than the age of 80 generally do not do well on dialysis. They have more complications from dialysis, and the risk of death is higher. What other things would you like to consider that are of importance to you? Deciding on a treatment for kidney failure is important, and often a very difficult decision. This takes time. Having information helps take some of the stress and worry away. Talk with your family, close friends, spiritual advisor, an elder, and kidney care team. Ask lots of questions. If you feel like you are too scared to ask questions, write them down and ask a loved one to come with you to your appointments. Start an advance care plan. This helps you choose a spokesperson for when or if you cannot speak for yourself. This helps plan what you want for your future care and where you want it, at home, in hospital, in hospice, or another place. A good resource to help you with your decision can be found at this website, ckmcare.com. This is very helpful in guiding you and your family through your decisions. The tool considers what is important to you. It can also help to talk with your kidney care team. There are other resources that can help you with your planning. The First Nations Health Authority in British Columbia and Living My Culture are both excellent sources of information. Your primary care provider, family doctor or nurse practitioner, kidney care team, and palliative care team may all be involved in providing care to you at end of life. The palliative care team is a group of doctors, nurses, and other healthcare supports that help with symptom and pain management to ensure you have a quality of life. you and your family will be supported to live in comfort and with dignity. Talking with elders, using traditional medicine, relying on your culture, and praying in your own way can also be a source of strength and guidance. Conservative kidney care is another treatment option for people with kidney failure. In this module, we talked about what conservative kidney care is, why someone would choose conservative kidney care, what things a person needs to consider when making a decision, and who will look after you if you choose conservative kidney care. If there is anything more you would like to know, please write down your questions and ask someone on your kidney care team.